So this is part of our sterile dressing pass-off, but before we get into the sterile dressing change, I wanted to go over some other procedures that may come into play with the wound care. And the first is irrigating a wound. So to irrigate a wound, like I said, we're going to remove the dressing. We're going to position the patient. Usually they're going to, if it's an abdominal wound, we're going to position them on their side such that we can place the wound similar to this. Like I said, so we're wanting to irrigate this, like I said, with usually NS is going to be used, but it could be any other solution that the doctor's ordered. But like I said, we want them on a side. We want the emesis basin here so that the fluid would run off of the wound and into the container. So we would have our container here of our NS and a large syringe. Like I said, this is our 60 ml syringe. But you're also usually going to use a smaller needle on this, because if you have a smaller needle on here, you're going to have higher pressure. So the PSI, which I believe is pressure per square inch or pounds per square inch of pressure. But anyway, it's like I said, if you have that smaller needle, you're going to be able to get more of a pressure with your irrigating. And the purpose of this, again, is to try to get rid of some of the drainage, promote that nice moist bed that we want. But again, without having to like swipe actually into that wound bed itself and disturb all that new lovely granulation that we want to be forming there. This is the way that we can clean the wound. So again, we're going to go to clean to dirty, which again, clean is our wound itself, and again, just pressuring, going along such as this, like I said, with irrigating that wound. This just, I don't even have to press it, just comes out of this syringe. But anyway, you can see the idea of that is, again, just basically just kind of giving a shower to our wound on the inside. The next thing I want to show is obtaining a wound culture. So if we're suspecting that there may be some infection coming on in our wound, so before a patient is put on an antibiotic, the doctor would order a culture of the wound. So again, we would want to clean the wound somehow, basically maybe by irrigation, like I just did, but we don't want to swab the drainage that is already in the wound, because it's already been exposed to air, so it's most likely going to have bacteria in it. So the solution that we want to get, the fluid that we want to get, is actually from the tissue itself. So anyway, so we're going to get one of our little culture kits such as this and open that. And this is, again, the kit, it's sterile. You don't need sterile gloves on for this. But again, you can see that there's a swab here, and then there is this test tube. And this is sterile as long as it is intact, and we're just going to twist this top off like so. So then again, with our swab, we are going to come here in our wound, and again, we're going to be kind of pressing a little hard on this, because again, we want to obtain fluids from the tissues of that wound. So again, we're just kind of swabbing the inside of that wound until the end of this swab is, like I said, you can see it's kind of a large Q-tip, until this is covered in fluid. And then once we've obtained that, we're just going to insert this into our tube and press that in tight. And again, once that is pressed in there, you can see it's released a fluid that is in here, so that Q-tip then is encased in that fluid. So it's going to have on here, we're going to put the patient's name, their room number, the time that we obtained this specimen, and we want to get this to the lab as quickly as possible, within an hour. So again, the idea of this is to do a culture on sensitivity. We want to see what's growing in this wound, so then the doctor would be able to prescribe the adequate antibiotic to take care of whatever is growing in that wound. So anyway, so that is a wound culture, and then again, irrigation of the wound.